Now looking beyond October 1st and to the 2014 election, believe it or not, It is right around the corner, at least in election speak. One of the big issues is going to be health insurance regulation.
Yeah. Look, for several years, health insurance companies in California have increased premiums, by double digits, just about every single year. And that's well above the rate of inflation.
Right.
So for the coming year, same thing going on. Blue Shield has announced an 11.7% jump. Aetna has scheduled 11.4% increase. And other companies are sure to follow suit. But meanwhile, here's the kicker. The inflation rate for 2013 is expected to be about 1.6%. Well, do the math. 1.6% inflation, double-digit increases, something doesn't work out, and the reformers want to say something about this.
Right, but the health insurance companies say, it's okay for us to make this money.
Well, yeah, I mean,
clearly they think it's okay.
They've got their defense, so to speak. The insurance companies say, look, reformers are blaming the wrong target. It's easy to blame us, but think about the hospitals who aren't run very successfully or efficiently. Think about technical changes, new developments in the health insurance industry, expensive machinery and whatnot. And if people want to curb rates, they really ought to be looking at hospital costs and these new technology improvements as the sources of the drivers, if you will, of these increases. But the health insurance companies also point to the Affordable Care Act. That's the Obamacare that we all hear about. Also as major causes of increase. So something is going on. They are certainly pointing their fingers other places, but the reformers are not going for it.
So the truth must be somewhere in the middle.
It always is.
So where do you find the truth?
Yeah, well, that gets to the reformers initiative. It's called the Insurance Rate Justification and Accountability Act. Pay attention to that one. You're going to hear a lot about it in the months to come. If approved by the voters, this would empower the the state insurance commissioner, to compel insurance companies to justify proposed increases and deny unjustified proposals along the way. So in short, the act would give the government the last say on health insurance rates.
But isn't that the case already? I mean, and pardon my ignorance if I should already know this, but don't they have to ask for permission to raise their rates?
Not in California, not at all.
Auto insurance.
They do,
that's
another story. Home insurance, that's another story. But not in terms of health insurance, no.
So this is something that I thought was already on the books. So what do you think is chance that this is going to pass?
Well, it's way too early. I mean, yes, the election is a year away, but it's still way too early. We know this much, that in 1988, a long time ago, the voters passed a proposition, it's called Prop 103, and that established the regulation of homeowners and automobile insurance policies along the lines you were asking. And this happened despite an $80 million insurance industry campaign against the proposal. Over the next 20 years after Prop 103, Californians saved $62 billion on automobile insurance rates. So that's a lot of money, So the bottom line is this. In American politics, governments are asked to regulate the private sector only if there's a compelling reason. Well, over the next year or so, both sides are going to make their case, and we're going to see from there which side prevails.
I think a lot of folks are going to say, I don't mind you making money, but do you really have to make that much money?
It's going to be
it hurts families.
A very juicy fight, and everyone's going to have the opportunity to weigh in on what each side says. But this will be a good one.
All right. We'll watch for it. Thank you very much.